Dear viewers, when a woman expects pregnancy, she tries to ensure that delayed periods are manifestation of pregnancy. In one of my videos, I talk about how a delayed period and positive HCG level can be not only signs of pregnancy but also diagnostic criteria for diagnosing pregnancy. What other methods do doctors use to diagnose pregnancies? Ultrasound examination. I will tell you about this in the video. If you're interested in the topic of ultrasound during pregnancy, watch this video. I'm Dr. Olena Berezovska and I welcome you to my video channel. Do not forget to press like and subscribe to my video channel. In recent years, there has been a great deal of excitement around ultrasound, largely caused by the women themselves, who almost have turned ultrasound into object of worship. It is not surprising that many women rush to undergo ultrasound during the very early stages of pregnancy. Professional associations of obstetricians and gynecologists do not recommend ultrasound in the early stages of pregnancy to determine its presence or duration, except for several indications. Why? At this time, ultrasound provides too little information. Therefore, there is a significant risk of false positive and false negative results. The earlier an ultrasound is performed, the more accurate the gestational age will be, is a false belief. A gestational sac with a diameter of 2-3 millimeters can be detected using a vaginal sensor at 4 weeks and 3 days. A 3 days delay in menstruation in a 28-day cycle. The yolk sac is the first structural part of the fertilized egg, conferring the presence of intrauterine pregnancy. The gestational sac becomes visible at 5-6 millimeters in size, that is not earlier than 5 weeks. From the 5th to 7 weeks, it should grow by 1 millimeter per day. The embryo can be detected with the vaginal probe only when it reaches 1-2 millimeter in size, which corresponds to 5 weeks of pregnancy. Ultrasound technicians and doctors use other criteria to establish a diagnosis of pregnancy, considering the level of HCG in the blood. A gestational sac can be observed when HCG level is at least 1,000-2,000 international units per liter. Therefore, according to the recommendation of most medical associations, it is advisable to perform ultrasound when its level exceeds 2,000 international units per liter. If at 5 weeks of pregnancy, that is when there's already a delay in menstruation and positive pregnancy tests, it is impossible to detect a gestational sac in the uterus, ultrasound should be repeated in 3-7 days to rule out an ectopic pregnancy. I discuss ectopic pregnancies in another video. Usually the embryo's heartbeat can be detected after it has grown to 5 millimeters, which corresponds to 6-7 weeks of pregnancy. By 5.5-6.5 weeks, the heart rate of an embryo should be 100 beats per minute. Over the next 3 weeks, the rhythm accelerated to 180 beats per minute. The most accurate gestational age that could be determined by ultrasound with the least number of errors, ±3 days, is 8.5-9.5 weeks. Thus, ultrasound was performed for the following reasons: confirmation of uterine pregnancy, diagnosis of multiple pregnancy and its type, clarification of the gestational age, confirmation of pregnancy progress or regression, as part of the prenatal genetic screening of the first trimester. There has been a lot of discussion about the safety of ultrasound in early pregnancy. Modern obstetrics considers 2 main indicators of ultrasound apparatus: thermal and mechanical indexes. Ultrasound waves hitting the surface of biological tissues and reflecting from them cause the cell to heat up. Tissues and cells that contain a large amount of water are heated more strongly. While such heating is insignificant for the uterus, which is several centimeters in size, the size of the embryo and its parts is millimeters or fractions of millimeter. The wateriest part of the embryo the brain is still very tiny. Therefore, it is assumed that during ultrasound, the embryo's brain tissue hits more than the rest of its organs and body parts. The thermal index characterized the ultrasound power, acoustic force, that causes the tissue to hit by 1%. This does not mean that a higher thermal index will cause more heating. As you already know, the degree of heating depends on the type of biological tissue. Some tissues, like brain, heat up even with a low index. Ultrasound is considered safe for the fetus if the thermal index does not exceed 2. During Doppler ultrasound, the index increases. Therefore, up to 12 weeks, it should be performed only for strict indications and no more than once. Usually, they perform ultrasound with Doppler after 24-26 weeks of pregnancy. Ultrasound not only hits the cells upon contact with them, but also exerts pressure on them. The mechanical index determines the amplitude of negative acoustic sound pulse pressure. During an ultrasound examination in early pregnancy, it should be between 0.05 and 1.9, but no more. Ultrasound examination is considered a conditionally safe procedure. However, if there are no clear indication for it, like bleeding, pain, suspected ectopic pregnancy, etc., it is not recommended to perform ultrasound before 11-12 weeks. We do not rush to draw conclusions. The diagnosis of pregnancy is confirmed if one or more signs of pregnancy and positive result of one of the diagnostic methods are present. In another video, I will discuss the use of ultrasound for prenatal genetic screening. In addition, if you are interested in the topic of pregnancy, you will learn more about ectopic pregnancy and empty fertilized eggs in next video. All the best to you.